welcome. Beta, in this video lecture, I will deliver the lecture on erythema multiforme. Okay, it is acute inflammatory condition of the skin. Don't forget, it is by the way, by definition, it is uncommon, self-limited hypersensitivity reaction type 4. Okay, to any antigen which I will talk about later. Beta, this is uncommon condition, don't forget, and it is hypersensitivity reaction type 4. Okay, the antigens may be any infection. Infection may be the herpes simplex virus or the mycoplasma bacterial infection or some kind of fungal infections like histoplasmosis or coccidiomycosis or some like kind of salmonella typhica typhoid infection, yeah, एक और bacterial infection mycobacterial leprosica, that is leprosy. Okay, these are some viral, bacterial and fungal infections that may act as antigen and they may trigger erythema multiforme. Some drugs can also cause the erythema multiforme. The drugs may be hydantoins, antimalarials, sulfonamides, penicillins, barbiturates और उसके अलावा salicylates. Okay, so infections, drugs, they can act as antigen beta and they can trigger hypersensitivity reaction and ultimately erythema multiforme. Some other triggering factors include some cancers like carcinomas and lymphomas and some other conditions other than cancers, that are the collagen vascular diseases like lupus erythematosus, dermatomyositis and the polyarthritis nodosa. That all are the vascular disorders, collagen vascular disorders. Okay, so there is a big list of antigens including infections, drugs, some other risk factors, triggering factors. They all are the triggering antigens that can trigger erythema multiforme. Okay, that is inflammatory condition of the skin. Okay, whatever the antigen is, whatever epidermal antigen is, we discussed, there may be like kind of infections, maybe kind of drugs or any other triggering factor, any other antigen. If it comes into your epidermis, into your skin, quickly it will be recognized by the infiltrating T cells. So T cells will quickly recognize it. T cells will quickly recognize it and they will start killing that antigen, and by the time they are killing that antigen, keratinocytes, that are the squamous cells of your epidermis, they will also be injured. Obviously, if the antigen is there in your epidermis and the T cells are infiltrating and killing that antigen, then obviously some of your keratinocytes will also be injured. Okay, and if I talk about these T cells, that in the central portion there will be what type of T cells? CD8 positive cytotoxic T cells. Okay, and in periphery there will be not CD8 positive but CD4 positive helper T cells and the Langerhans cells. Okay, right. And one thing that has to be mentioned here, written in your textbook, that there is a condition that mimics the same pathogenesis, that include number one, acute graft versus host disease and skin allograft rejection. They too are the conditions which mimic the same pathogenesis. Okay, so what happens in case of erythema multiforme? Let me quickly again tell you that any epidermal antigen, the list we just discussed, if it gets into your skin, the T cells will infiltrate. Okay, and they will destroy that antigen and obviously some of the keratinocytes as well. Right, now beta, let me quickly tell you that, yeah, morphology part, the morphology part of erythema multiforme. You will see beta that in case of erythema multiforme, why do we call it multiforme? Because there is diverse arrangement of lesions. There is not a single lesion that occur in every individual with erythema multiforme. Some people may develop macules, some may develop papules, and some may develop vesicles and some may develop bulla. These are the blisters. Okay, so some may develop vesicles or some may develop bulla. So, and in the very important and the characteristic lesion of the erythema multiforme, that appears mostly is targetoid or target-like lesion. So I mean to say, in case of erythema multiforme, why do we say it is multiforme? Because there is diverse arrangement of lesions. And there is not a single lesion that every next individual with erythema multiforme develop. Some may come up with macules, and some may come up with papules, and some may come up with blisters, either vesicles or bulla. Okay. And the characteristic lesion that mostly people come up with is target like lesion. Let me quickly show you what I'm trying to say. Yeah, if you see here, this is characteristic lesion of the erythema multiforme. The target like lesion. Can you see? Isn't it more like a target? This is the periphery, and this is the center is like a target. Okay, so this is the characteristic lesion of the erythema multiforme. People mostly come up with this, but don't forget, people may come up with one of these as well, right? By the way, two variants of erythema multiforme that I have to explain you very quickly, and don't forget beta, this entire lecture is from your textbook Robbins basis, so you can keep book with yourself and you can follow everything. Two variants of erythema multiforme. Okay, one is Stevens-Johnson syndrome and one is toxic epidermal necrolysis. Stevens-Johnson syndrome is when erythema multiforme involves your skin very much extensively, okay, and it often occurs in children. That it's kind of thing when erythema multiforme gets very much severe, then it is called Stevens-Johnson syndrome. It's a condition of very much severity of erythema multiforme. So okay, erythema multiforme when gets very much severe, it is Stevens-Johnson syndrome then, and it appears on skin, oral mucosa, and even on the lips, conjunctiva, urethra, and the genital and the perianal areas as well. Okay, let me quickly show you Stevens-Johnson syndrome beta. Yeah, here in this picture you can see Stevens-Johnson syndrome. Can you see it is involving these kind of lips, oral mucosa inside? Okay, so this is Stevens-Johnson syndrome, the severe form of the erythema multiforme. Severe form of erythema multiforme. Okay, it is not restricted to skin only. It involves the oral mucosa, conjunctival mucosa, the urethral mucosa. Okay, और अगर इसके ऊपर सेकेंडरी इन्फेक्शन हो जाए बैक्टीरिया का, तो फिर बेटा ज़ाहिर लाइफ थ्रेटनिंग सेप्सिस हो सकती है. बहुत ज़्यादा बैक्टीरियल लोड अटैक कर सकता है यहाँ पे, और वो बैक्टीरिया ब्लड में जा सकता है और सेप्सिस करा सकता है. ठीक है. स्टीवन-जॉनसन सिंड्रोम के अलावा बेटा एक और वेरिएंट है एरिथेमा मल्टीफॉर्म का, दैट इज़ टॉक्सिक एपिडर्मल नेक्रोलिसिस. It is the condition, it is the variant of the erythema multiforme in which there is diffuse necrosis and sloughing of cutaneous and the mucosal epithelium. जो mucosa की epithelium में अपर मोस्ट लेयर है और जो स्किन की अपर मोस्ट लेयर है उसकी नेक्रोसिस होती है और स्लफिंग हो जाती है. ऐसा लगता है पूरी स्किन जैसे जल गई हो, बर्न्स आ गए हों. देखें, यू कैन सी इन दिस पिक्चर, इट्स मोर लाइक द कंप्लीट एपिडर्मिस इज नेक्रोस्ड and there is sloughing of the skin. Okay, yeah, are you clear with these two terms of erythema multiforme? One is Stevens-Johnson syndrome and one is toxic Stevens-Johnson syndrome and one is toxic epidermal necrosis. Okay, now I will better tell you the morphologic histologic characteristics of targetoid lesion. Okay, target like lesion, look, it was like this. Okay, it was like this. The characteristic lesion of erythema multiforme was like this, the targetoid lesion, the targetoid lesion. Okay, and what are the characteristic histologic or morphologic features of this targetoid lesion? There will be edema in the dermis and the lymphocyte accumulation along the dermoepidermal junction. So necrosis will be at the level of junction of the dermis and epidermis. Necrosis of keratinocytes at the dermoepidermal junction, and that is then called interface dermatitis. Okay, when there is an inflammation and necrosis of the cells at the dermoepidermal junction. But don't forget, with time these lymphocytes will migrate to epidermis. Initially what happened, let me quickly tell you, that if this upper portion is epidermis and below is dermis, okay, then there is dermal edema, one thing that I told you, And next thing that I told you, that there is lymphocyte accumulation at the junction, at the dermoepidermal junction. So necrosis and inflammation will be here at the junction. So this inflammation and the necrosis at this particular level is called interface dermatitis, because it is in the interface between the epidermis and dermis. Okay, but don't forget that these lymphocytes with time they will migrate into epidermis. Okay, and then you can see with time lymphocytes migrate into epidermis, and they will then cause एपिडर्मल नेक्रोसिस, द नेक्रोसिस ऑफ सेल्स इन द एपिडर्मिस. ओके, जब सेल्स की नेक्रोसिस हो जाएगी तो यहाँ पे ब्लिस्टर्स बन जाएंगे, फ्लूइड फिल्ड ब्लिस्टर्स. ओके, और यहाँ से एपिडर्मिस स्लफ ऑफ होती जाएगी. ठीक है, एंड देयर विल बी फॉर्मेशन ऑफ shallow erosions. Let me quickly show you the shallow erosions which occur due to sloughing of the epidermis, which is due to formation of blisters. You can see in this picture this shallow erosion. This is due to epidermal sloughing. Okay, which is due to blister formation, and blister formation was actually due to epidermal necrosis. So yeah beta, that's all about today's lecture on erythema multiforme. Hope you got some concepts. Thank you so much. Class dismissed.